day that I went home was the best day ever. I had been in hospital for 3 weeks and I was so desperate to be home for about the last 10 days. So the day I got to go home, I was very excited. I felt ready about a week before I went home. I was ready to go home.
I think I got that used to the hospital. I thought I'd call that home, but I prefer Foster. It was nice. Nice to get home. And I learned how to be to adjust all the little problems, and we managed to,
We got through it, yeah. Just carried on as normal. He was no different than the man he was before, only that he couldn't speak. But we managed to get through all that. It was very quiet in the house too.
Yeah, I didn't have to answer the phone.
No, you didn't have to answer the phone.
It was easier when Kath was in hospital because I knew there was somebody in there looking after her and she had 100% professional care all the time. I could visit before and after work. Coming home was probably a bit scary for me. I know Kathy really wanted to come home. I thought she's not quite ready to come home yet, but she wanted to, so we come home. And all of a sudden that level of care you've got 24 hours a day, you know that's there for the push of a button, is not here. And especially when you're still going to work. I know Aaron was here if Kath needed anything, but sometimes I think, well, what's Kath going to be like when I get home from work? So it is a lot higher responsibility than what you used to, but you cope.
I think that when Mum came home, it was easy and difficult at the same time. Being in the comfort of our own home was comforting for Mum because it's an environment where, you know, she knows it's comfortable for her. So it was good in that respect, but I also feel as though Mum felt a little bit insecure being at home so early just because she'd had that regular care and she didn't have a button to press if she needed something, and that was on us. So I think that's where the nurses they came every day to check up on her. I think that was really vital. So I think that's a really great tool for people that are going home, just to have that check-up, even, support there. So I think that was good.
I just got on with it. I knew what to do. The nurses at John 100 showed me what to do and helped me, and I just got on with it. You know instinctively what you have to do and what you don't do.
And I was a bloody good patient.
And he was a very good patient, yes, he was.
When we first got home, we found too many visitors wasn't a good idea. We had, it was too much noise, and Bristol wasn't well enough to cope with visitors, and struggling to eat and drink. He wasn't feeling the best, and the noise was way too much for him, and I think you're probably better off planning to have visitors drop in 2 or 3 days later maybe, and when you're coping better with it all.
Yeah, sometimes, even though Kath was at home, still had to be strict with visitors at home. It was just taking too much out of her. So even though hospitals have limited visiting times, it's for the good of the patient. And when we come home, Kath didn't have much energy to go past those sort of times either, at times. And we've had to say, you know, look, Kath has just had it. She's got to go to bed now. So just because you're at home doesn't give you that extra energy or doesn't sort of change everything straight away overnight.
If you do have a computer or an Android or one of those smartphones of some sort, and if you have Facebook on it, what I did is I started a group called Barb's Group, and it has a little apple next to it because an apple a day keeps a doctor away, sort of thing. And what I did is that you can invite who you want to be able to see within that group. And from before my operation, I was keeping people up to date in that group, all my friends and family. But it was really, they found it really helpful because it showed so clearly exactly what was going to happen to me. They didn't, we weren't getting, my daughter and I were not getting phone calls every 5 minutes asking what was happening, and we're having to tell the same story over and over and over again. And so we're just putting clear, concise and factual information within Barb's group for every step of what I had done. Like even after the operation, I even had photos of my my bed where I was sleeping in John Hunter, my face when I just come out of the operation. I got my daughter to take photos. I said, oh, yeah, everybody's got to see exactly what's happening, and especially those that smoke. It might stop somebody from smoking, but see, they've got to go through this.
We also have not just family support, but we have a lot of friend support. Who just said, look, I know your family's there, but if you need anything, call us. And we always, at first we felt strange to take people's help, but it didn't take long for us to say, we'll do that for them. At this time, we'll take any help we can get.
If you need help, it's there. And it's one of the things that makes the whole process work very well.
On behalf of the Hanks Social Group, I'd like to welcome everybody here, especially some new members who've come to join us. This is quite it's a social club, and we're pleased you can come along and hopefully can meet some friends and talk about things, but just generally relax. That's the idea of it.
Having a social group where you can be amongst people who've been through a similar thing to you and talk about it, like our war stories, if you like. It can be a really wonderful feeling, the human contact for people who can otherwise become isolated, and can be a stepping stone into getting back into society and living more of a full life, interconnected with the people around you.
Well, the Hanks Group it was initiated by Dr. Eisenberg about 3 years ago, and the idea was to people to learn about the problems and to associate with each other, and also to share some of the problems that you have. And from that group of 4 of us volunteered, and we formed a little party, and we've been going 3 years now, purely as a social effort. And at a social, you get people can talk to each other. They don't always talk about their problems, but in fact, the opportunity is to talk and to learn about what you can do about the things that are affecting yourself, your lifestyle and your body. So it's been very effective.
When I found out after the operation and through the hospital of the support groups that they knew about, I've made it one of my goals to get involved with those groups. You don't have to worry about not being able to eat what's there, because everybody that's there has been through it. So the food is more or less geared to your ability to be able to eat, which is one of the big issues that makes a big change in your life, how and what you can eat. And everybody understands it at those groups. And I would recommend both of those support groups to anyone going through this process.
It's important for people to be able to meet others who've had this problem. It sort of explains that you're not alone in this thing, and you also have a opportunity to judge your own problems, dare I say, with the problem of others, and some are better and some are worse. But there's never any feeling of why me or anything of that nature. It never seems to arise at all. Nobody says, why me? They just accept it and just come for the social aspects of it.
There is a gentleman that goes through one of those groups, and he's had the mirror of what I've had. He's 5 years down the track, and I can see the scars are still there. The issues are still there, in a smaller way, if you like. You learn to adapt, you learn to change. And the things that concern me at the moment, he's been through. He knows it. And he's living his life to the full.
I've got thing to know that there's other people, that you're not alone. That there are other people that you can help overcome it. After 39 years, I feel that I have helped so many people through their tough times can know that there is a light at the end of the tunnel, that you can survive.
It is important to look after your own health because I was diagnosed with depression about 6 months after it came home. But I had to keep going. So I stayed with him for about 3 months and didn't go out, only did the shopping and looked after the bills and did things like that. And I said to Ed one day, look, I think I'll go back to playing bowls, which I hadn't done. I'd always played golf for many years, but I'd taken up bowls just before Eddie got sick. I said to him, I think I'll go back to bowls. I think I need to get away from you for a little while. When the nurse is there and the people next door, our neighbours, were wonderful. If I wasn't there, one of them would come in and sit with Ed. And I found it was a bit of a relief to get away from him. And you have to get on with your life and do the things that you used to do. Go for a walk. Just get out and go for a walk on the beach or something, which I did do. And when I got home, I used to feel terribly guilty for leaving Ed, but he would write down, don't be stupid.
After surgery, physically you may look a little different. This may impact on your intimacy with partners. It's very important that you have very open communication with a partner, and remember that intimacy is not all about sexual intercourse. There are other ways to be intimate. You can kiss, cuddle, hug, touch. It's all about becoming familiar with the change in the way that you look.
At first, it was a bit scary, wasn't it, at first?
Yeah.
Yeah. But we've been married for 34 years. We have a good relationship, both sexually and
Love-wise, communicate, yeah.
Yeah. So, well, neither of us would have wanted it to be a problem, would we? No. So we've had to deal with little issues and just get a little bit creative. Just our positions that we might sort of be in. As I said, Ronald sometimes finds that with his head down, he sort of has a bit of a run, don't you?
Yeah.
Yeah. But otherwise, no, it hasn't really.
No, we're still in love and everything else is.
Any problem? Yep.
Yeah, we're still in love. We're still the same people like we were before and after the surgery. So, yeah.
If you are having trouble becoming intimate after surgery and after the acute hospital phase, it would be really important to seek support in the community. There are quite a lot of support groups with people who have experienced similar issues, but there are also relationship counsellors, there are psychologists and other social workers in the community that can help assist with overcoming the barriers to being intimate.
When you go home, we find that's often a time when people will actually begin to develop what we would call a clinical depression. You're isolated from the hospital, you've had lots of support while you're in hospital. You'll notice that, you know, the fatigue is starting to get worse. You're losing interest in things. You don't want to participate. And it's very, very common for people with head and neck cancers. They're one of the highest levels of cancers that develop a depression afterwards. And that relates to a lot to the change in body image. You often look very different in your face. You might be missing an eye or an ear. That's a difficult thing to cope with. And I often worry more about the people that don't develop a depression. You know, it's normal to respond in that way. There are plenty of opportunities for you to help yourself in this circumstance, going to support groups, talking to other people, you know, that have been through the same situation. Coming and seeing the psychologist, and we're still happy to see people as outpatients once you've gone home from hospital, talking to your GP, talking to your care coordinator, try and access the services, but again, talking is the most important thing, you know, and recognising it's normal to struggle with this. It's a really difficult time.
Personally, I think men hide things better than women. Women seem to be able to let it go, whereas men, I think, internalise it more than speaking about it. And I've found since I've had the operation, I'm more prepared to talk about it now. Maybe I was lucky. I had some really good friends that I could speak to about anything before and after the operation, including all the doctors and the nurses.
You will get through it, you know, with the support and tapping into all of those resources. There is an end point, and people do get used to living with these changes in their lives. I've seen a lot of patients over the last 10 years who've had to struggle with these changes, and they do get there. It might take 4 or 5 years before you begin to feel confident again, but you will feel confident and you will be able to get back into your life and live the new normal.
It's now, I suppose, about 14 months since the operation. Last time we filmed, it was only about 4 or 5 months since I last had any treatment. I've gone back to work since last time we spoke, and everyone at work has been very supportive of me. I've gone back to playing sport, and I'm also keeping fit by doing some walking. I'm doing 5Ks 4 times a week now. There's always the very easy road to slip back into of doing nothing and just feeling sorry for myself and I can't eat that and I'm not hungry. But the exercising has helped stimulate my brain, keep me active, and getting back into work has also encouraged me to feel a lot better about my progress. And it's the new norm, trying to get back with the old norm and just taking each day as it comes.
It's been 14 months since, so it was March last year, 14 months since I did the operation. And yeah, it's been gone very quickly. And sometimes it almost doesn't seem like it happened. I've almost forgotten about it, but I think about it. Yeah, 14 months or so, but it's gone very fast. Be reassured, whoever may watch this, it's going to go very quickly.
You learn to live with it. You just get over it. Ed wanted to get on with his life, so did I. And we just started to live normally and just put it behind us. It's gone, it's finished, it's over. Let's just get on with it and make the most of it, which we do. We don't ever let it get us down now, ever.
Oh, occasionally the dirts.
He gets the dirts because he can't eat a steak or a chop.
The hardest thing for me to ask is, do I still look normal? And people said, yeah, you're still Graham. So that did me. I was happy.
Since I was last interviewed, and I've got my nose, that back to being the same old person, because like walking down the street and going out and nobody knows. It's just the only ones that do know are the ones that know that you had your nose removed. But yeah, no, it's marvellous. It's just made such a big difference. Yeah, there is a detailed process you go through. It's not just get there and pick a nose, off the shelf. With me, it was 6 months, post-surgery, and after that, you've just got to look at what the finished object is, and it's great. I'm stoked with it. So, yeah.
If I was to offer advice to someone going through what I've been through, in the early period, the biggest advice I would give them would be to try and be patient. It is a journey, but there is an end to it. On a day-to-day basis, it is very hard to see long term. It is very hard. But supportive family, supportive friends, and learning that you will get through it. You are a lot tougher than you think you are, and it is not until you have to go through something like this that you build from that inner strength. You will be surprised at how you adapt, and that's the thing. The learning to adapt, I think, would be the biggest information I can give to someone. It's adapting. And that's what it's all about.
I don't know. It doesn't bother me. People think it does and I'm just hiding it or something, but it doesn't really worry me. I'm 52 and, I've had a great life and, I was cute when I was younger. That was all right, I had my time. I don't care if I've only got one eye now. No, but there's more to you as we get older and you learn that, learn to live with what you're left with. And honestly, I don't like it. I would be lying to you if I said, oh, I like the way I look. I hate it, that I've lost my eye, but I don't dwell on it. I don't use it as an excuse to exclude myself from social interaction. I don't use it as an excuse to exclude myself from being in a relationship with someone. I don't use it as an excuse for anything. I feel that it's almost a written story on your face about survival. You had to do that. You had to go through that, and that's no option. So now there's no option but to get used to it, to deal with what you're left with and get on with your life.
And, I don't regret having the operation. To me, having the operation means that here I am walking, talking, breathing, and I'm going to get to see my grandchildren grow up, and I'm get to see my daughter grow a bit older. Get to see my son come back from UK and see my grandkids from over there. I'm hoping to go over there again. And so I've sort of got so much to look forward to, and I've got a lot of skills, and I want to be able to utilise those skills for my people, being an Aboriginal person. And if I can, I don't like to sort of let them go to waste. So while I'm well enough, I'm going to work and help my people. So I have been given a good prognosis from Dr. Hoffman, and so long as I continue with this radiotherapy, and then I'll just see what happens from there. But I do not regret having any of it. Do I like the pain or the discomfort or the travelling or the tiredness or the exhaustion or anything else? No. But will I continue with it? Yes. And because at the end of it, I'm going to have my life back. That is my ultimate goal.
I would say I'm back to 90% of what I used to do 10 years ago. I'm not afraid to go out and do the things I used to do before. I still go out and do them. And I think that's what it's all about, to keep on going in life.
I'm 7 weeks post-surgery now, and in 4 days I'm going to start radiotherapy and 3 courses of chemotherapy. I'll be going 5 days a week for 6 weeks, and then hopefully I will be finished with this. I'm going to live to 100 and drive Ben crazy. That's my plan. That's what I'm focused on. That's my plan. And when everything's going on, it's very hard. We have to focus on the future and just back things out of the way so we can get there.
I have a good life. I have a good husband. And I feel that it's the way you take life, the attitude you've got towards life. God was not going to let this be me in my 20s. I've seen my 2 children grow up, get married, get 3 grandchildren. They're absolutely beautiful children that I idolise, that they are my inspiration. I hope to be here to see them grow up and get married.
So, whilst what you're facing right now is confronting and scary, I can reassure you that we wouldn't be offering you this treatment unless we thought it was worthwhile and that you'd come through the other side. And I regularly see my patients for many years in follow-up, and it's wonderful to discharge someone from follow-up because to all intents and purposes they're cured. And it's wonderful to see them down the track living their lives, doing the things they love, sailing, going out, being involved in the community, being involved with their family, watching them come back with their families. It's great to see, and that's why I love this work. And it's also great for me to see the human spirit, to see people who come in who are terrified about what they've got to go through. And then in the end, they get through it and they triumph. And they're richer people for what they've been through. None of them would like to have gone through it, but they're still richer people for having gone through it.
Right. So I was a bit worried.
I think it's Star Wars. It's one of those, I think. I can see that. It's trivia.